A tingling feeling in your feet, muscle cramps that wake you up at night, or a heavy dragging sensation in your legs by the end of the day. These might seem like small everyday problems, but these small signs are actually early warnings that your blood circulation might not be working well. Many people ignore these signs because they feel minor or think they're just part of getting older. However, these symptoms could mean your circulatory system is starting to have trouble moving blood properly throughout your body. When blood flow slows down or gets blocked, it can cause serious problems. If ignored, this can lead to a loss of freedom and movement, a lower quality of life, or even life-threatening health issues. Circulation problems usually begin slowly. You might notice some swelling in your legs or feet, or feel a little discomfort and brush it off as nothing. But over time, these small issues can become much worse. They can turn into ongoing pain, deep tiredness, trouble walking, or dangerous health problems like blood clots, varicose veins, nerve damage, or even strokes. Unfortunately, many people only see a doctor when these problems become too big to ignore. That's why learning about these early signs is so important. Recognizing them early and taking action can help you stay active, healthy, and avoid serious health troubles later on. In this video, we will explain 5 key warning signs that your blood circulation might already be under strain. We will help you understand what each symptom means and how you can respond naturally to protect yourself. You will learn about 4 important vitamins that can help improve your blood flow, strengthen your blood vessels, and protect your heart. These vitamins are not rare or artificial. In fact, they are common nutrients you might already have in your kitchen. These nutrients are supported by scientific research and recommended by healthcare professionals. They help keep your blood vessels flexible, reduce the chances of dangerous clots, and improve the health of your legs and feet, the parts of your body that often suffer the most from aging and gravity. We will also share advice from Professor Dr. Joel Esbriger, a leading expert in regenerative medicine and orthopedic care. With decades of experience and many published studies, his guidance is trusted worldwide. He stresses the importance of not ignoring symptoms related to circulation because early treatment can save you from serious complications. If you often experience numbness in your legs, notice changes in skin color on your feet, suffer from painful cramps, or see visible veins, don't ignore these signs. Your body is trying to tell you something important. This video will teach you how to understand these messages and, more importantly, how to take the right steps to protect your health before problems get worse. Imagine your blood circulation as a vast highway system inside your body. Along these highways, blood carries oxygen and important nutrients to every cell, tissue, and organ. When this system works well, you feel full of energy, strong and healthy. But when circulation starts to slow down, or parts of the highway become blocked, especially in faraway places like your feet and legs, your body sends early warning signs. These problems can happen for many reasons, like plaque buildup in the arteries, weak valves in the veins, high blood pressure, diabetes, lack of exercise, smoking, or simply aging. When blood flow is weak, oxygen and nutrients can't reach your cells properly. This causes pain when you move, muscle cramps, numbness, cold skin, slow healing of cuts or injuries, and in serious cases, blood clots, strokes, or heart problems. One of the most dangerous things about poor circulation is how quietly it develops. Many people think cold toes or swollen legs are just normal parts of aging and don't pay attention. But these signs mean your blood vessels are under stress. When veins or arteries lose their flexibility, blood flow is disrupted, increasing the chance of clots that can block vessels and cause lasting damage. Poor circulation also makes it hard for your body to remove waste and toxins from your cells. This leads to inflammation, higher risk of infections, and faster aging of your cells. Your nervous system is affected too. Without enough blood flow, nerves in your legs may not get enough oxygen, causing sharp pain, burning feelings, or numbness. This is often seen in people with diabetes or vascular problems. Dr. Joel Esbriger, a top orthopedic and regenerative medicine specialist, says blood flow is essential for healing and vitality. Without good circulation, nothing in your body works well. The good news is that poor circulation can often be managed or even reversed, especially if you catch it early. Simple changes in your daily habits, along with targeted nutrients and natural vitamins, can help bring your blood vessels back into balance and protect you from future harm. Over the next few minutes, you will discover exactly what signs your body might be showing and how to respond before these problems get worse. Next, we will walk through 5 major symptoms that often appear one after the other, each one more serious than the last. This will help you spot these problems early and take the right steps to protect your health. You will also learn about 4 essential vitamins that support healthy circulation. These vitamins are natural, effective, and safe for everyday use. They help restore balance and protect your vascular system. First is vitamin B3, also known as niacin, which helps expand your blood vessels, making it easier for blood to flow through your body and lowering the risk of clots. Then vitamin C strengthens your blood vessels and reduces inflammation. Vitamin K helps prevent harmful clots and keeps your arteries clear, while vitamin E protects your vessels from damage and helps them relax for better blood flow. These vitamins work together to keep your blood vessels healthy and flexible. The best part is that you can find all of them in common foods you may already eat every day. So if you've noticed any of these early signs or simply want to keep your circulation strong as you get older, stay tuned. We're about to share simple, natural ways to support your vascular health and keep you moving freely for years to come. Are you ready to learn how small changes can make a big difference in your life? Let's dive in together. Understanding how your body signals trouble with circulation is the first step toward protecting your health. Poor blood flow doesn't just affect your legs or feet, it impacts your entire body, including your heart and brain. That's why it's so important to recognize the warning signs early and take action before the problem worsens. In this paragraph, we'll explore in detail 5 major symptoms that often appear when circulation begins to suffer. Each symptom is more serious than the last, so knowing what to look for can help you act quickly and avoid serious complications. The first warning sign to watch for is changes in the color of your skin, especially on your legs and feet. Have you noticed your ankles or feet looking unusually pale, bluish, or covered with dark patches? At first, these color changes might seem like simple cosmetic issues, but they are often early clues that your blood flow is not normal. When your skin looks pale or bluish, it usually means that oxygen-rich blood is not reaching those areas well. You may also notice that these parts feel colder than the rest of your body. Cuts or blisters in these areas might heal slowly and can turn into infections if not cared for. This is a clear sign that circulation is struggling and needs attention. The second symptom is muscle cramps, especially when walking or at night. If you have ever had a sudden sharp cramp in your legs that forces you to stop walking, this could be a sign of a condition called intermittent claudication. This happens when your leg muscles do not get enough oxygen because the arteries that supply blood have narrowed. Many people also get painful cramps during the night, which can disturb their sleep and lead to tiredness during the day. While rubbing or stretching the leg might ease the pain temporarily, the real cause is poor circulation that needs to be addressed. The third symptom to notice is frequent tingling and numbness in your feet and legs. If you often feel pins and needles or numbness, especially after sitting or standing for a long time, don't just think it's because of your posture. Regular tingling and numbness could mean that your nerves are stressed because they aren't getting enough blood. Over time, this can lead to peripheral nerve damage, which slows down your reflexes, dulls sensation, and can even affect your balance. These symptoms should never be ignored because they signal deeper problems with your vascular health. The fourth sign is cold feet, even on warm days. Do your feet feel icy when the weather is warm? This happens when blood cannot reach your toes properly, often because blood vessels are narrowed or blocked. This cold feeling might seem harmless, but it can be a sign of serious artery problems like atherosclerosis. When blood flow is reduced, your feet also lose their natural defenses, making them more likely to get cuts, infections, and heal slowly. This is why cold feet on warm days should always be checked by a healthcare provider. The fifth and most visible symptom is the appearance of varicose veins and spider veins. Varicose veins are bulging, twisted veins that often look blue or dark. They happen when the valves inside your veins weaken, allowing blood to flow backward or pool in your legs. This extra pressure stretches the veins, causing discomfort, swelling, and a heavy feeling in your legs, especially after standing for long periods or at the end of the day. Spider veins are smaller, red or purple lines near the skin's surface, and also show that your veins are not working well. Many people think these veins are just a cosmetic issue, but Dr. Joel Espreger warns that poor vein health is a serious problem. If left untreated, it can lead to complications that are harder to fix and may require surgery or long treatments. If you notice 2 or more of these symptoms, it's time to see a healthcare professional. Simple tests like a vascular ultrasound can detect circulation problems early before they become dangerous. Early action gives you the best chance to improve your circulation naturally and avoid invasive procedures. Now let's talk about the 4 essential vitamins that support healthy blood flow and vessel health. These vitamins are safe, natural, and easy to include in your diet. The first vitamin is B3, also known as niacin. Niacin plays a key role in widening your blood vessels, which helps blood flow more freely through your body. This reduces the chance of blood clots or blockages. When your vessels expand, more oxygen and nutrients can reach your tissues, easing symptoms like leg cramps and fatigue. Niacin also helps balance cholesterol by lowering bad LDL cholesterol and increasing good HDL cholesterol. This protects your arteries from fatty buildup, keeping your blood vessels flexible and lowering your risk of heart disease and stroke. You can find niacin in foods like skinless chicken breast, eggs, salmon, tuna, and almonds. For example, a 100-gram serving of chicken breast can provide over half of your daily niacin needs. While supplements are available, taking too much niacin can cause a harmless but uncomfortable flushing of the skin, so it's best to get it from whole foods. Next is vitamin C. which does more than support your immune system. Vitamin C helps keep your blood vessel walls strong and elastic, which is essential for steady blood flow, especially to your lower legs and feet. It's also crucial for producing collagen, a protein that supports the structure of veins and arteries. Adequate collagen helps prevent damage to your vessels and reduces the risk of varicose veins. Vitamin C's anti-inflammatory properties also ease swelling and that heavy feeling in your legs after a long day. Additionally, vitamin C is an antioxidant that protects your blood vessels from damage and premature aging. Great sources include citrus fruits like oranges and lemons, kiwi, berries, guava, which has more vitamin C than oranges, and vegetables such as broccoli, red peppers, and spinach. To keep vitamin C strong, eat these foods fresh and avoid exposing them to light or air for too long. Vitamin K is often overlooked but is very important for your circulatory health. It helps control blood clotting, preventing both excessive bleeding and dangerous clots that could block your arteries. Vitamin K also protects your vessels from calcification, which occurs when calcium builds up in the vessel walls, making them stiff and less efficient. This is especially important for people with high blood pressure or varicose veins. By keeping your vessels clear and elastic, vitamin K supports better blood flow and helps stabilize blood pressure. You can get vitamin K from dark leafy greens like spinach, kale, arugula, and broccoli. Some fruits like kiwi also provide vitamin K. A great way to get more of this nutrient is by drinking fresh green smoothies made with kale, apple, celery, kiwi, mint, and a touch of ginger. If you take blood-thinning medication, talk to your doctor before changing how much vitamin K you eat. The last vitamin to know about is vitamin E, called the protector of your blood vessels. It acts as a strong antioxidant, fighting harmful free radicals that cause your vessels to age and weaken. Vitamin E helps keep your artery walls flexible and less likely to tear or get damaged. It also helps prevent blood clots and supports smooth blood flow. Another important job of vitamin E is helping your body produce nitric oxide, a compound that relaxes and widens blood vessels, easing the heart's workload and lowering blood pressure naturally. Foods rich in vitamin E include avocados, especially the darker parts near the skin, extra virgin olive oil, sunflower and pumpkin seeds, almonds, and green vegetables like spinach and broccoli. While vitamin E supplements exist, taking too much can increase bleeding risk, so it's better to get it from whole foods. Now that you understand the key symptoms of poor circulation and the 4 vitamins that help support your vascular health, it's time to think about how this all fits into your everyday life. Circulatory problems are not just small annoyances. They can be the start of bigger health issues affecting your heart, brain, and ability to move freely. Symptoms like numb toes, leg cramps at night, pale or patchy skin, and heavy legs are often mistaken as normal signs of aging. But they are warnings that your body is struggling to maintain balance inside. The good news is that you don't need drastic or expensive treatments to improve your circulation. With careful attention, simple lifestyle changes, and good nutrition, you can dramatically boost your circulation, increase your energy, and protect yourself from serious health problems. Here's a quick summary. Vitamin B3 helps widen blood vessels and balance cholesterol. Vitamin C strengthens your vessels by supporting collagen production and reducing inflammation. Vitamin K controls clotting and prevents harmful calcification. Vitamin E protects your vessels from damage and helps them relax for better blood flow. Each of these nutrients plays a special role, but together they create powerful support for a healthy and flexible cardiovascular system. The best part? All these vitamins come from everyday foods that are easy to add to your meals. If you want to start improving your circulation today, begin by listening closely to your body. Notice any unusual feelings like tingling, cramping, or skin changes. Write them down if it helps you track patterns. Then make small changes like trying a fresh green smoothie in the morning, swapping out packaged snacks for a handful of almonds or seeds, adding leafy greens to your lunch, and choosing whole fruits instead of sugary desserts. These small steps done consistently lay the foundation for big health improvements over time. If you already have symptoms, a family history of circulation problems, or take medications, be sure to talk with your healthcare provider. They can guide you safely, adjust treatments if needed, and help you make the best choices for your body. Remember, taking care of your circulation means protecting your independence, improving your movement, getting better sleep, and feeling peace of mind every day. If this video helped you understand your health better, please share it with someone who might benefit too. Many people ignore these subtle symptoms for years, but knowledge can truly change and even save lives. Your support by liking, subscribing, and sharing this video helps us reach more people who want to stay strong and healthy as they age. We love hearing from our amazing community too, so please comment below with your age and where you're watching from. Remember, better circulation starts with small steps you can take today. By paying attention to your body, nourishing it well, and making simple lifestyle changes, you are investing in your health and freedom for the future. Don't wait for serious problems to appear. Take control now and enjoy a life full of energy, movement, and vitality. Thank you for watching, and we look forward to seeing you in the next video.